So this is an exercise called the prone hip internal rotation and external rotation, or simply a prone knee bend. The whole idea here is that you're trying to learn that your knee bends without you moving your back or your pelvis. Your hip, the ball and socket, it can move separately from your pelvis and from your back. So the reason you're likely getting this is because you tend to over tighten at your lower back or around the glutes when you don't need to. And so it's giving you some issues in a whole bunch of different ways that can happen. So I'll just kind of lay down and instruct what you're supposed to be doing and how you're supposed to be doing it and what you're supposed to be thinking about. So you start on your tummy. Now you will have to be flat. You have to be like this. I can't really teach you like that. So I'm going to teach you where you can hopefully see my right leg. So you'll start flat on your stomach. I doubt you'll need a pillow. You shouldn't need a pillow for this. What I want you to think first is we're just going to do the knee bend. So let's say if I lift this leg up. If I bend and then I start to flex, so my pelvis starts to lift up, you'll feel that by touching the bone on the front of your hip. So if I bend this up and I start to feel, and you can't really see it, but I have to exaggerate. If there's any movement at all, that's wrong, okay? If there's any lift at all, that's wrong. All that should be happening here is me using my hamstrings to bend my knee. My pelvis should be completely off and my back should be completely off. So in order to make sure that I don't use my back, or if I don't overuse something else on my pelvis, I want to think about tightening my belly button towards my spine. I monitor with my front hand on that bone, okay? Then I just relax. I keep my belly button towards my spine. And I slowly go up to 90 degrees. I don't need to go past that. And then I control down. That should be completely quiet everywhere except my hamstrings tightening and my belly tightening. So that's the prone knee bend to 90 degrees, okay? Now, once you have that down, if that's fine for you, you hold to the 90 degrees, still monitoring with your front hand, belly button still going towards the spine to keep your back off and to keep your body, so your back is neutral. Then you slowly let the foot fall inwards and slowly come back to center and then let it fall outwards. There should be no movement of your pelvis here. So when I go across inwards, it shouldn't be that I feel like my pelvis is pushing into my hand. It should just be forward, not doing anything, nothing changes. It should be effortless except for the belly button going towards the spine. And a little bit of muscle work in your butt, but it's mild, mild, mild. You really shouldn't feel that. So the pace that I'm doing there is pretty good, and the range that I have is pretty good. You only go as far as you can go where there is no rotation of your pelvis.